Before I came down for this conference, I was faced with a patient who was adamant that she no longer wanted any treatment at all for her macular degeneration. And this was based on misconceptions that she'd had and misinformation that she'd had. And it reminded me that where we, of course, should always look at large randomized controlled trials for guiding us in terms of our protocols and treating patients, we still do need to look at individuals and individual conceptions and circumstances in order to guide our therapies. And so today, what I'm going to be talking about is the individual experiences of patients that we've seen at Manchester over the last couple of years. And I'm going to be basing the presentation on information from two main sources of independent questionnaires. And these were questionnaires that were taken by somebody outside of the treatment regime, and not by myself, but by an independent nurse. And then some retrospective assessments of patients from their notes. So in terms of preconceptions, we asked patients in an open-ended question about their previous experiences with anti-VEGF injections. I guess we were expecting to hear all sorts of horror stories, but actually we found that patients who were keen to have Oraya therapy did not necessarily have horrible experiences with their injections, but were still keen to pursue other forms of treatment. We asked patients why they wanted to go on to the Oraya therapy and what results they were hoping to achieve. And again, we found the expected predominance of people wanted fewer injections, but there were also patients who had other motivations, more vague motivations, and patients wanting better vision. We then went on to more detailed questionnaires, and this is a lady who was treated in Manchester, actually had one eye done, was pleased with the results, and then requested for her other eye to be done. And we had questionnaires for 5 patients where we asked them to grade things from 10 being very, very positive down to 1 being very, very negative. And what we found was, so these are the average responses for the whole group, and so we found that patients actually had a good understanding of, or they felt they had a good understanding of the Oraya therapy, and also had very high scores for the comfort after the procedure, and that they tended to be very positive about recommending the treatment to family and friends. We did get some still quite good scores, but lower scores for comfort during the procedure and duration of the procedure. And we looked into those into a bit more detail. In particular, there was one lady who actually was wearing dentures, and she only told us afterwards that she wished we had told her to remove those dentures. We also had some problems with giving 3 sites of beam therapy in a couple of patients. But it's important to remember that these are things these are treatments we gave very early on in the development of the Oraya machine and the software, and those particular problems have now been addressed in the newer software. So what about patient outcomes? We did go back then and look at the last 10 patients we had treated with Oraya therapy. We wanted to, see what the results were in terms of the injections, but also see if we could see any patterns emerging in terms of which patients got better responses. And so this is the table of patients, there were 9 in total, who we thought had especially good responses. We looked at the number of injections they had before the therapy, and compared it for the preceding 6 months, and then compared it to the number of injections they had after therapy. And 2 things came to mind. One was that there was quite a dramatic response in these patients. It wasn't a drop of a quarter or a third or even a half, but even more dramatic responses for these particular patients. But looking at this and combined with the results of what we class as the poorer responders, we did not find any particular patterns that jumped out at us in terms of future treatments and which patients we should treat in future and which we maybe should not treat in future with the Oraya therapies. So overall, we learned a few things from this. Firstly, that it is important for us to make sure that patients are well educated in terms of what they should expect to, with the benefits they should expect to have, and perhaps the ones they maybe shouldn't expect to have with the Oraya therapy. We found that patients tolerated the treatments actually very well, with high levels of recommendations, and we expect these to be higher as the newer hardware and software is developed. But we did find that the outcomes, while sometimes were very, very good, we found it that we weren't able to necessarily predict those from the nature of the condition beforehand. And so it's one reason why I'm particularly pleased to be here today and hopefully share our experiences with colleagues, and maybe as we move forward in future get more information that might allow more of our patients to be in that first group for their own benefits. Thank you very much.
Good. Any questions? Have you modified your own sort of case selection? What are your thoughts on that?
I really am not sure. What we did find was that some patients were really keen on treatment, and there was one particular patient I remember who we resisted treatment for because she had some fibrosis and she didn't have a very high macular volume. She was very keen on treatment though, so eventually after some months down the line, we did treat her. And she was one of the people who had a really excellent response. And so that was one thing that hit home to me, that actually maybe we need to know more information. We need to know more about what patients might respond or might not. We go along the guidelines of the subgroup analysis, but try and keep an open mind still if patients are particularly keen.
Sure, makes sense. Good. Well, thank you very much.